Welcome, Brenda. Welcome, Brianna.
Hi, Noe. How are you?
Good to hear yourself.
Fine, thank you. It's nice to see you.
Likewise. Yeah, how's everything?
Things are good. Things are good. Yeah, I had this last week off, so kind of splitting it between relaxing and catching up on stuff and, you know, stuff.
We all need that time to for ourselves, really.
Yeah.
Yesterday was that day for me. Just spent the day all by myself with my thoughts, and so refreshing when there's nothing to do,
Yeah.
just being.
Yeah. I spend a lot of time I just kind of have a like tendency to just my natural tendency is to always be busy. And so one of my big things has been to kind of just discern like what do I really need to do? Mm. And most of the time, I don't need to do a lot of the things that, historically throughout my life I've compelled myself to do. So it's kind of nice to be able to see that clearly.
Yeah, there's always seems to be so much to do. I know I used to be in the world of doing, right? Like I was just working so much that I suffered what I thought was, oh, I'm having a heart attack. This was like maybe 15, 20 years ago, but really it was like a panic attack from just so much doing.
Yeah.
Now I experience life on the opposite, like there's not much to do.
Yeah.
But obviously like circumstances and perspective. But now I kind of take a almost like a very passive yet knowing things get done type of approach. Like there's nothing really to do, but things will still get done. The priorities still come up. We're still being pulled like gravity, basically, for things to happen through us, right?
Yeah.
But like this heaviness of that I affect life or that I'm creating anything is really like there's a freedom and liberation from that because it's almost like, wait a second, whatever needs to get done, it's gonna flow through and it's gonna get done. And it's gonna
Yeah.
feel more like I guess what I'm saying, instead of work, it's gonna feel more effortless
Yeah.
than work.
Yeah. I mean, we kind of get to be like a conduit for
Yeah,
the important things and not get caught up in all of the other stuff that can be kind of trivial.
right. So we're waiting for our guest speaker, Victoria, but she should I confirmed with her yesterday and we talked a few times, so she should be on. I'm sure she's probably getting off some sort of appointment or what have you, but it should be a very good call. In fact, like I have no clue as far as hormones, right? So this is going to be very much an educational call for me, and I'm sure it's for everyone because she's such an expert. She's actually wrote like two books from the woman's perspective, and she's also writing a book from the men's perspective. So
Mhm.
we're all in for a treat. I feel I am. Yeah. Welcome, Brenda.
Hello, how are you?
Good in yourself.
Good.
What brought you to us? I don't think I've seen you on our calls before.
I just now found Meetup and I'm just trying to get a feel for it. So yesterday I went on to two other sites that were interesting to me. So I thought I'd join this one as well.
Awesome. It should be a good call. Like I mentioned, hormones is not my area of expertise. In fact, when I had this guest speaker sign up, I was like, I was thinking, oh my God, like usually it's more like on the healing perspective from like a spiritual, emotional, mental approach. But
Mhm.
this really is more of a practical, everyday physical healing, right? How do we take care of this physical vessel so that we are in an optimal state of well-being?
And
So
you know,
definitely we're in for a treat.
there's
Hi, Julie.
hi Julie. I think there's a lot. I mean, I don't know, for me, like as my hormones have started shifting and stuff has just started changing, like I'm looking for, as I do in a lot of places, like what are the spiritual meanings about this? What's the deeper energetic, like what are the lessons to be learned here? And there is a very physical process. It's very biological. It's part of our human body, but it's like there are those deeper levels too. So it's like, how do you kind of synchronize
Right.
that and connect it all? It's so interesting.
I so appreciate that you just mentioned that because like the physical is not just the physical. You know, we like to kind of like be very segmented as far as how things work, the mind, the heart, the spirit, the soul, so many things, so many language, right? Like it's just how we language reality. But yeah, you're absolutely right. I feel like everything is 100% connected. So what is that spiritual root? What is that emotional root? What is that mental root, right? Looks like we have our guest speaker on, Victoria. Welcome. Usually I like to give it a minute or two more to just allow everybody to trickle in. I think we had like 15 people confirm that they were going to be on the call, but that's never an indicator of who actually shows up. We usually have more or less, about 10 to 15 people. Sometimes we get a full house. But we'll see what we get here. It may be an intimate group, but I'm sure we'll have more people trickle in. Welcome, Bonnie.
Hello, everyone. First time joining this event. Very interesting topic. Looking forward to some insights.
Thank you for joining us. Yeah, we're all in for a treat. I think you might have missed a part where when I first uh, signed up with Victoria to speak on our Healing Conversations meetup. She brought up the subject of hormone, and for a second there, I was like, "Oh my God, this feels like a very an area that I have no clue whatsoever. I have not been educated, so we're all in for a treat. We're all definitely going to get educated and hear it from the expert's mouth as far as how can we be in a good state, a good balanced state with our hormones, and just experience life from a better perspective, just feeling better all around. So definitely appreciate Victoria being on the call with us today. Oh, okay. So that is not Victoria. Okay. I thought it was Victoria at first. Okay. Okay, sounds good. So then, it's 11:05 and our guest speaker, let me hold on a second. Let me reach out to her just to make sure we're on the same page here. Hold on a second.
Hi, Melanie. It's Julie.
Hello, Julie. How are you?
Good. How are you?
Good, good. Just plugging along.
Hanging in there. Yeah, yeah. I
Yeah.
guess no, I don't know if you heard it, but Noe is checking with the guest speaker,
Oh, okay.
seeing what's up. Do you guys know, anybody know if are these recorded or no?
Sometimes I think sometimes we record some like this one's being recorded, so
Oh, yeah, it does say they're up there in the corner.
awesome. Well, I got me a sewing project to work on while I listen today. So it's like, you know what? It's probably be healthier to listen to than just random YouTube videos. So
Yeah.
Hi.
Yeah, I'm interested in the topic for
Hello.
sure.
Okay, so we have our guest speaker on the call. We just had a little confusion on the link. Welcome, Victoria. Welcome, everybody here. Welcome, Melanie. Welcome, Josh. Let's get the call underway. So, as you all know, today we have our special guest speaker, Victoria, and please excuse me if I'm mispronouncing it wrong. Mondloch, is that correct?
You did it perfectly,
Perfect,
Mondloch, right.
perfect. So you'll be talking on the subject that about hormonal imbalance to balance for better health and just better well-being. Dr. Mondloch will be taking us on a journey into the realm of hormonal balance with this expertise on hormones. She's also the president and founder of Victoria J. Mondloch, MD, SC, and former medical director of the Wisconsin Stem Cell LLC. She has been a trailblazer in the field of hormones. Her approach to patients' care focuses on education and empowerment, allowing patients to understand their bodies and maintain healthy lifestyle habits. So, with accolades such as the National Association of Professional Women, BIP Women of the Year, and Medical Director of the Year in 2020 by the International Association of Top Professionals, Dr. Mondloch has been recognized as the most empowered female physician in 2022. Her dedication to patient education is evident through her original hormonal research, weekly radio shows, and insightful YouTube videos. She's also published 2 books, and she's working on more books. The books that she's published, which maybe we'll put a link sometime during the call, is Blossoming, Becoming a Woman, and Full Bloom, Perimenopause, Menopause, and Beyond. Let's all welcome Dr. Mondloch. Thank you for being on the call. And we so look forward to you enlightening us on the subject of hormone balance.
Well, and thank you very much for that beautiful introduction. I feel very passionately that patients do not know what their optimal health is. I'm going to say this and be on the record to say this. Doctors don't know how to help patients know their optimal health. And I say that because hormone balancing is the foundation of your health. Think of your 4 hormone groups in your body as 4 legs in a chair. And if you actually have any of those hormones out of balance with the others, you sit on that chair and guess where you land up? You land on the floor and you don't even know how you got there. So you dutifully rewrite your chair, but you're doing the definition of insanity, doing the same thing and expecting a different result. So you sit back on that chair and it's Groundhog Day. You keep falling and falling and falling. So you go to your doctor and they do their blood work and they say to you, well, your blood work all looks great. So, but doc, I don't feel good. And well, all your blood work is good. There's nothing I can do for you. Get out of my office. So when patients are told that over and over and over again, then you start thinking, well, what's wrong with me? Why can't I feel good? Well, then you start getting told you're depressed and now you're being put on psych medications. And it's like, wait a minute, nobody is looking for the root cause of what's going on. And if they would check these 4 hormone groups, then you would have at least the start of your journey as to what's off. But medicine doesn't do that, and they don't even teach hormone balancing in medical school. So holy smokes, where are we supposed to get this? Well, that's why I started writing the books that I write, because hormone balancing is not only huge, but it's the foundation of your health. So, I'm going to ask you, and I'll just put you on the spot. Noe, when was the last time that you actually had your testosterone levels checked?
Right. I just had a physical, I think in August or October of last year, and I don't even think they check for testosterone levels at all. Like it's never
I'm
come
going
up.
to tell you they don't. They won't even ask you if they should check it. When was the last time you had a cortisol checked?
Is that like, yeah, I don't cortisol. So I don't cortisol, I don't, that's not like, yeah, you know what? I don't think that's ever even been checked either.
Right. How about an insulin level? Maybe
What's
your
that?
blood sugar, maybe an A1C, but never your insulin.
I don't think, no, no insulin, I don't think either.
Right.
They do a
And
blood panel, but I don't think that's included in there.
it's not even in there. The fourth leg, they do lip service to. They do one test for your thyroid, a TSH, with a reflex free T4. But that's it. They don't do the full thyroid evaluation, and they miss the other three legs. Well, I'm sorry, testosterone is your life's blood. In women, it's not only our female hormones, we also make testosterone. And sometimes it's so out of balance, we're more male than female. What? You know, so it's knowing for your age where you should be. For guys, is your testosterone for your age where it needs to be? Or are you having issues like poor sleep, short-term memory loss, hair loss, mid-abdominal weight gain, muscle aches and pains, constipation, bloating? These are all things that tie to your hormones. And in women, your female, male. In guys, your testosterone. What? Short-term memory loss, that all ties with your hormones. And nobody tells you any of this. So how hugely important is it not just to know where your numbers are, but to know that you're not just in the reference range, but you're age appropriate for your age. So my job and my ideal patient was always the patient that walked in and said, "Doc, I don't feel good." And that was, I would kind of rub my hands together in my mind and go, okay, perfect. Because I would run through my single page of symptoms that they may have, some of the stuff I just rolled off, and they'd mark a bunch and I'd say, give me your top three. Insomnia, short-term memory loss, and mid-abdominal weight gain. Okay, what if I told you I could get rid of all three of those and get rid of them in 6 to 9 months? And then we'll start working on some of the others as we go. Really? You could do that? Yeah, we're going to do it with blood work that your insurance is going to cover, and you're actually going to have answers instead of your blood work looks good and get out of my office. So what a refreshing change of pace. You're walking in, somebody says, I feel you, I hear you, I know what you're telling me, I'm listening to you, I have a solution for you, and now this is what we're going to do about it. Now you're partnering with your healthcare provider for your optimal health. What a concept, right? And that's just one leg of your chair. Imagine now cortisol, which is your stress hormone. Well, golly gee, who's got stress, right? Well, and it can be physical stress, it can be emotional stress, it can be financial stress. Stress comes in many different ways. But if you have high stress, guess what? You're straining the other hormone groups because they're all talking to each other and they all have to balance with each other. So if your cortisol is really, really high and you're in adrenal stress, you're going to have heart palpitation, short-term memory loss, mid-abdominal weight gain. Gee, some of these symptoms are sounding pretty familiar, right? Yeah, because they're talking to each other. And your male or your female is going to start trying to help out your cortisol, but it's not balancing. So you're getting some of those same symptoms, even though it's high stress. And we've all heard, gee, those executives who have high powered jobs, it's such a stressful job. That's why he had a heart attack at age 50 instead of, normally you'd get that in later age. Well, is it really that the cortisol led to low T and the low T led to the heart attack? See, nobody looked back then. Or was the low T contributing to the stress so that it was more of a stress on that patient? And either way, it's leading to a premature heart attack. So why don't we at least explore those 4 hormone groups, know what they are? And that's what I write about in my books. But that approach, I can actually send to you as a primer that you can put on your website for your podcast, and people can download it so they know those 4 groups. Absolutely. I can send you information about my books, which show women, there's a men's book coming, but show women what are the issues you may be struggling with and how can you deal with it? What are the myths? What are the truths? What's the research? And then how to talk to your doctor. What are the labs that you should have done? And if your doc says, I don't do those labs, this is a real shocker. Are you ready? What if your doc says, I don't do those labs? Are you dead in the water? No, because you know what? Patients can draw their own labs. You don't need a doctor's order to get your blood work done. What? Really? Yes, there are 2 national labs. Quest is one, and the second one is Life Extensions, which is a subsidiary of LabCorp. And so you can go online, order your own labs, which I talk about in the book, what are the labs to draw, and then you pay for your labs online. They send you your receipt, right? And then they tell you, check by your zip code the lab draw station closest to you. You walk in, show them your receipt, they'll draw you. Then they say, where do you want your labs drawn or sent to? Well, you want them sent back to you. You want control over your own labs. What a concept. Wow. You don't need that doctor to order what you want. They're not going to say to you, well, I can't do that because, they won't allow me to check your hormone levels. Well, you now have plan B. You can check them yourself.
Wow. Thank you
That's
so
pretty
much.
wild. Isn't
It
that
is.
just totally empowering?
Right.
So that's what my mission is to make certain that everybody knows that health is your right to know. And do we want to be just okay with our health, or do we want to be in optimal health? Because hormone balancing also does this. And if you can reverse and prevent Alzheimer's, holy smokes, isn't that just phenomenal? They'll tell you they're working on research for new drugs for Alzheimer's. Well, we can prevent it. We just haven't been given the resources and the tools of how we can prevent our own Alzheimer's. As Americans, we're brainwashed into, oh, you have a problem. That's when you come see me. Oh, and I have a pill for that. Oh, you have a side effect from that pill. Well, I have a pill for that pill side effect. Oh, it's not working for you and you're depressed. I have a pill for that. We're so conditioned to, I have a pill for that mentality, that we don't take prevention seriously because medicine doesn't take prevention seriously. One of the tenets in that Alzheimer's book is balance your 4 hormone groups. What a concept. Wow. So if I say to you, do you want to have good health or do you want to have optimal health? What would your answer be?
Optimal all day long.
Bingo. So why do we settle for just good enough? Because we
We're
think
not
we have
educated.
no other, we don't think we have any other choice. So my job is to educate and say you do have another choice.
Thank you so much. Just
So
you making us aware that we can take charge of our own health and order our own blood work. I mean,
Right.
that wasn't anything that I've ever even thought about.
Right. So now the control is back where it needs to be, and you're in the driver's seat again. You're no longer in the third seat way back there trying to get the attention of your doctor, you know exactly what you want drawn. You can get it drawn. And then if your doctor goes, oh my gosh, I don't even know what these tests mean, then guess what? You've got the wrong doctor. Then you go looking for the doctor that will help you interpret that. And if you can't find that doctor, I will give you permission to hand out my email address and they can contact me.
I so appreciate that. We do have a question in the chat. They're asking,
Sure.
do insurance companies cover the cost for these type of tests?
If you're getting your doctor to order it for you, then yes, your insurance will pay for it. If your doctor says, I don't order those tests and you're ordering it yourself online, then you're paying for what you're ordering because now you are taking that responsibility. But you have to ask yourself, what is that worth to you? And then again, if you get those test results and you say, oh my gosh, my doctor doesn't even know how to interpret these, there are many docs out there, naturopaths and functional docs that will interpret that. Just because they don't teach this in Western medical schools doesn't mean you have to stay with a Western medical doc who isn't helping you. We do that when we walk into a store and we don't find what we're looking for. What do? We walk with our feet and with our pocketbook, and we go to the next store and we look for what we're looking for, and then we will give our monetary and our loyalty to that store. Well, it's the same with your health. And what's more precious than your health and preventing Alzheimer's and preventing breast cancer? Oh my gosh, hormone balancing can prevent breast cancer? Yes, even if you carry the genetics that say you're at higher risk, the BRCA, you can still prevent it. It's just you have to know the tools and the resources to do it with. We've never been told. So that's my job. My job is to educate and empower and then let you know there are resources out there. You can get the answers.
You talked a little bit about a checklist, like things to look out for, like our individual health. Could you
Correct.
maybe
Correct.
talk about that a little bit,
So-
like how we're feeling to see like, you know, where we're at?
Right. And this is in both books, but realize that there are multiple symptoms that cover every organ system in your body. That this I will also send to you, so you have it to put on your site. But this is something that I called my intake and my follow-up. In other words, when a patient would come in and say, I don't feel good, then I would go take 2 minutes to go through this sheet with them. And again, they may say short-term memory loss, insomnia. They may say muscle aches and pains. They may say, I've got abdominal bloat. I take 2 bites, doc, and I've got to unbutton my waist because I'm bloating already. What is wrong with this picture? Or I'm putting on mid-abdominal weight gain. So this is one of those really powerful tools that you can actually, have this tool, check off your symptoms, take it into your doc with your blood work and go, I have all of these. Can we talk about this? And you're going to blow their mind because they're going to go, or they're going to go, yeah, right on. Let's talk about this because you're right. Hormone balancing is going to take care of everything that you've marked on here. It may take us 6 to 9 months, but you know what? We're going to rebalance you because this is perfect. You've done some of my work for me. And that's the doc you want to be seeing.
We have Melanie with her hand up. I think she has a question. Melanie?
Sure.
Sure. And this is kind of a tough one, but I'd love to know your take on it. I have someone very, very close to me in my life who is 75 years old.
75 years young.
Yes. Was born with Klinefelter syndrome.
Mm-hmm.
And he's a veteran. So the VA does his health care, and they waited until he was mid 70s to start administering testosterone to him for the first time in his life. And what was really disturbing about that is after they started this hormone therapy with him, he started engaging in criminal behaviors I have never seen in him before. It was very frightening. He's always been a very religious, devout man, and all of a sudden I don't recognize him. And I want to know, because he keeps saying, well, it's just because the testosterone made me do it. And I want to know, like,
Perhaps, but I'm going to ask you a question that you may not be able to answer. Do they follow his level?
I don't think that they do.
So
I really
how-
don't know, because he
Right.
won't let me be involved in any of this medical stuff anymore, because he's also frightened, thinking that I'm going to
Oh, sure.
take his land
Right.
away from him. It's become
Right.
really scary. Yeah.
But
And
I'm
I'm
gonna
wondering
sh-
if this is more dementia.
Well, but I'm going to show you this graph. And again, I can get this graph, to Noe as well. But there are age appropriate levels for testosterone too. And if they're giving him too much, he went from his glass is empty to his glass might be overflowing. So if he doesn't know where his levels are, he went from 0 to 1,000 miles an hour with, with 1 or 2 treatments. And that's, too much of a good thing is still too much, and it can still cause aggressiveness and whatever. But there are age appropriate testosterone levels for him to be at. And at age 75, he should be at about 40th percentile. And he may be at 80th. So that may be an inappropriate amount of testosterone, but they need to check and see what his body is doing with what the doses they're giving him.
Okay. I guess my question is more of a legal and moral standpoint from where I'm at, because I can only do so much, legally
Right.
to try to protect him. But if and when he is arrested for some of these behaviors, which I think is going to happen, I guess, and for my own conscience of trying to prevent that from happening, like, how much of this can we blame on the testosterone, and how much of this is just
You can't until you know the levels. In other words, you have to have the information. Information and knowledge is key. So to just guess that it could be that without the science backing it, they'd throw that out of court laughing. So you have to have the science that backs up the claim, and without that you don't really have a leg to stand on. So if you can convince him that getting his level checked so he knows where he is, that is huge. We all work off of information. We don't just guess that little knock in our in hearing our engine in our car. We don't just assume that, oh, that's nothing. We usually go to the mechanic and go, what's the problem? You don't just make an assumption and then all of a sudden your car blows up. You need your car. Well, we need our body, and you need your brain, and so you need to know what you don't know, which is, where is that testosterone level?
okay. All right. Yeah, that gives me a good place to start if and when the law catches
Well,
up.
or if and when the opportunity, if you have a chance to send him this graph that I'm going to send on to Noe, if you have a chance to actually send him that and say, I'm concerned for you. I want to make sure that you don't have any issues going on because your testosterone may not be appropriate for your age, your level. I need that to be, you need to know that you are where you should be. And then we'll have a better discussion about whether or not this behavior is due to testosterone.
Okay. Yeah, I think
Does
right
that
now.
make sense? Mhm.
Yeah. I think right now he's a little too, he won't even talk to me. He's a little too paranoid. I think sooner or later the law is going to catch up and want his next of kin to take over, in which case I will then be ready with the information to help him.
Well, and you could still send it to him. That way you can say, I tried to help. I tried to intervene, and I sent the information, and at least, I did my due diligence. And you
Okay.
can send it to him once a week and just say, hey, I love you. I just want you to know this information. Have you acted on this information? Once a week, just send him the graph and say, hey, just want to check in. How you doing?
Awesome. Thank you.
You're welcome. Good luck.
Do we have anybody else that would like to ask our hormone expert, Victoria, any questions, concerns? Julie?
Yes, I would love to. Hi, Victoria. Thank you so much
Hi,
for
Julie.
coming on. Or
Oh, my
Dr.
pleasure. Thank you so much.
Dr. Mondloch. Is that how you pronounce it?
Yes, thank you.
Yes, this is great information about like getting your own blood drawn, and also just that hormones are the foundation of health. Like I just didn't realize that. Because I had a full hysterectomy, ovaries taken out about 5 years ago.
For what
And I
reason?
went into, pardon?
For what reason? Are you comfortable saying the reason why?
Sure. Yeah. Well, originally they thought that I had ovarian cancer, but then they went in and they saw like I had severe endometriosis, which was kind of a surprise to me because I didn't even have pain until I did, and then that's why I went in to get it checked. It was just like a stabbing pain. But
Mhm.
anyway, so it's a long story, but I was in Mexico, so I got it done there. Maybe could have got better care in the US, I don't know, but so that happened. And then I took a little bit of hormones like the first year, and then it was a pill. Then they wanted to switch me to a patch, and I did that. I didn't like the patch. And I was like, I can just go without it. But now I'm having all these symptoms that you're saying, and I'm like, maybe that was a bad idea, and I want to get like back on hormones. But I'm just wondering, like, what's the step, I guess, that I should take? Because I did tell a doctor, and she's kind of like, well, I don't know. It doesn't sound like you have it that bad. And like, she didn't want to give me this pill because I might have some liver thing. I don't know. That's another long story. But anyway, I'm just wondering about what you think too about those private clinics that check your hormones and everything, or
Well,
I think a good
you know,
step would be.
yeah, and this is a great example of the system failing you, so to speak, because they missed your endo, okay, and that's something that is an estrogen dominant diagnosis, which means you were out of balance for years to get to that level of endometriosis that socked in your pelvis. That meant you had to have not only an endometrioma from your ovary taken out, but they just cleaned you out. So you just went from being a female to you now only have estradiol that your body fat makes as a conversion from estrone, and testosterone, which your body still makes. Okay. So you have no counter to your estradiol. You're still estrogen dominant. Guess what? You could still grow endometriosis implants that are microscopic in your belly, and you'd be back in the operating room 15 to 20 years later because you have pain, and you may not even think endometriosis. But is it a good idea? Yes, because you were estrogen dominant for whatever reason. So you are still making from body fat estradiol. You still need to counter that with progesterone, or you're at risk to have other hyperstimulation, breast, bad mammogram, breast cancer, which is what the etiology of most women who are 10 or 15 or 20 years post their menopause, whether it's surgical or natural, that's where their breast cancer comes from. And medicine ignores it. And they say, oh, it's easily treated. We'll just take it out and we'll do chemo and radiation and you'll be fine. You'll live the rest of your life just fine. Well, who wants that route? Nobody. So again, what I would say is know your levels. You have to know what your baseline is. Even now, without having taken anything, you need to know your starting point. Then you need to know, with putting it back in, where you are. Are you in balance or still out of balance? And then adjust accordingly. And so I always did the blood work check for hormone levels versus salivary, because my argument to patients was, do you have saliva in your brain for that short-term memory loss? Do you have saliva in your joints, in your muscles for your muscle ache and joint ache? You don't. You have blood. So blood is what carries our hormone around to our body. So you always should do it by blood work and know where your levels are so you can rebalance it. And you may only need to put in some progesterone because you may have a good enough estradiol level. But if you don't, even though you're estrogen dominant, you still might have to put a little estrogen in, but then you still need the progesterone to balance it. The progesterone is huge, or you're looking at, other issues like cancer of breast and whatever down the road. So nothing that you want to deal with.
Yeah. Yeah, that makes sense. So you have on your list there or in your book or something that you're going to share, like I got some of these things you're supposed to check, like the testosterone and the cortisol. And I'm just wondering the list of the things we're actually supposed to get checked.
Well, that's in, yeah, so it's kind of a list because the 4 hormones groups are a smaller list. If I say thyroid, you just get a TSH. You'd be told just to get a TSH when there's really 5 tests that go into it. So I list that all in the, in the last chapter of the book of how to talk to your doctor. It will list all of the blood tests that you need to get done. And that's going to be your quote unquote list of what, if they'll draw it and they'll only do some of it, then you know what is left that you might have to go out and draw for yourself. But know that you can draw your own blood work. So
Yeah, that's great. Yeah, I was also wondering why it seems like what you're saying is the reason that they just don't take it seriously, but why do we have to go to private clinics to get our hormones checked and balanced and get a special like formula that we have to pay out of pocket, right? Versus just having it part of healthcare.
well, wouldn't that be great if they would teach this in medical school? Guess what? They don't even teach it. It isn't considered important enough. What people need to kind of understand is that medicine and the machine of medicine, the business of medicine in this country is not about keeping people well. They don't want that at all. Okay, they'll pay lip service to prevention and they'll say, oh, get your mammogram so we know you don't have breast cancer. Well, that's too late. By the time you see an abnormality on a mammogram, you've missed 10 to 15 years of balancing your hormones to know that you wouldn't even be in that spot. You know what I'm saying? So medicine is in the business of sickness. They want you in their hospitals. They want you getting chemotherapy and radiation. They want you getting surgery. If you have painful cramps, they're going to tell you, I'll put you on the pill. We'll just cover that up. They don't say those words, I'll cover it up. They'll say, we'll put you on the pill. That'll take care of it. Well, wait a minute. What I want is let's dive down to the root cause of why I have cramps. They won't go there. They're not taught to go there. They're taught cover it up. And then when it becomes such a problem that now you need surgery, well, now I can help you because surgery, ka-ching, 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 is now going to make us money. And that's a rather crass look at modern medicine. But if you think about it, that's really the way they approach things. They took the annual exam away from women and said, you only have to come in every 3 years. Well, that's your touchstone to the doctor that you could say what was changing year to year to year. Now, 3 years for a lot of people becomes 5 years. And so where is there any continuity? Where is there any education? Where is there any ability to have that conversation with your doctor that things are changing? There is no opportunity.
Yeah, that's depressing, but thank you.
Well, it's the reality, unfortunately. Now, that's Western medicine. Naturopaths and functional medicine docs, they are so much more in tune with balancing your body. Western medicine wants a specialist for this and a specialist for that. And they're so pharmaceutically plugged in that they don't see the forest for the trees. They don't see the body as working as an integrative whole. They see it as a thyroid. They see it as a muscle disorder. They see it as a heart doctor, whatever. They specialize and subspecialize so much that one medication from your heart doctor may throw off your medication for your kidneys. Well, they don't care. Go talk to your kidney doctor, but I need you on this dose. The kidney doctor goes, oh my God, you can't be on that. So they fight, but they don't talk. So you're the one who suffers in the middle. So I'm giving you a way to take charge. And yes, is it wrong that we're paying for our own blood work? Well, sure, it's wrong. But the point is that do you let that happen to you, or do you walk with your wallet and walk with your feet?
Yeah.
Get the answers you need.
Well, I was actually asking specifically, do you know about those hormone clinics? They're actually like for women, menopause, and like, oh, we'll take the blood work and we'll like mix it together and create a specific formula
As long as you do it and you get bioidentical hormone back, don't go for pellets. Pellets, once they're put in your butt every 3 months, you can't get them out. So if you have a reaction or if it's too much, you cannot change it because it's already in you. And so who wants a foreign body every 3 months put in their butt? Nobody that I know. Yet people willingly go and do it. You also want blood work checked, not salivary and not urine, because those are very specific to what's in your mouth or what you excrete. Well, you want to know what your body is going to use. So blood work, which is what all the European research on bioidentical hormone is based on, versus the salivary or urinary that American research based it on, the urine and the salivary is not accurate. So not only do you need to know your blood levels, but they need to be balanced and followed. So that's the key. So if the clinic is going to do that, great. That's great. But if they're not going to do it with blood work, then look for another clinic that will.
Victoria, so question. So you have this checklist, so we can take charge and get empowered with our own health. Now, do
Exactly.
you also have like a series of to-dos based on that checklist? Like, let's say we're deficient on whatever, or we're imbalanced on whatever. Is there like I'm sure you have the expertise, and I'm sure it's probably in the book somewhere where you say, well, if XYZ happens, then do XYZ to get into a state of balance. Is that contained in your books, or do you have guidance as far as that as well?
Well, that's going to be so individualized per person because it's going to depend if you're on other medication for any reason, what is your activity level, there are other factors that if the same advice for the same numbers may not work at somebody who's 25 versus 45 versus 75. So it's the danger in giving a protocol with specific guidelines is that doesn't work well for everyone that's going to try to follow that. So general guidelines of balance it and know where you should be for your age is the better approach. And so that's why I wrote the books. And again, I'll send you the primer so people understand the 4 groups, the 4 hormones, the 4 legs of the chair. But it takes knowing where your levels are and we constantly tweak and balance, just like the weather changes and we change what we wear outside. We still in our bodies change, our metabolism levels change with the seasons. And so you have to know how to follow your body and know that your levels done in February may be different than levels that are drawn in October or in the summer where you're more active versus the winter when you're less active. So it's, we're constantly balancing our body, and we should know that that's what we have to do. Just like you do an oil change in your car every 10,000 miles, you do it because otherwise your car won't run right. Well, you want to keep tabs on your body or your body isn't going to run right.
No, that's so insightful. We have a question in the chat. They want to know where your office is located at.
Well, I'm retired. So this is the compilation of all of my work. And so what my mission is, even though I'm retired, is I'm not done. There are so many people that don't know this information that my mission is to get the word out. And so I'm here to empower, you, and you now take this information to clinics and your doctor, and you find the people that will help you. And if you cannot, then what you have to realize is that Western medicine may not be your answer. It may be a functional doctor or a naturopath that can help you. So
Do you have resources to point us in the right direction? Should we need to go from Western medicine?
I do, and that'll depend on where in the country people are, because in the infinite wisdom of governments, they decided post-COVID ending that doctors cannot just do telemedicine anymore. They have to have a license in the state that they're talking to that patient from. So imagine at $800 to $1,000 per state getting a license in 50 states. Well, that's cost prohibitive. Who's going to do that? And they do that to control the message. So So, it's new since the end of COVID, but you would, be best then looking for, and I have some of that I'm still building, is the resource list of what doctors in what states will do this for you.
They were asking, so are we to look for a naturopath doctor or osteopath doctor?
Well, an osteopathic doctor may still be in a Western medical system. If they're working for a hospital or they're working for an insurance company organization, they're told how they can practice medicine. They're not the boss. You'd think they are, but they're not. Their boss is the CEO of that hospital or the CEO of that organization. And they tell docs, you cannot check hormone levels. We won't let you go there. So you have to realize whom you're seeing and what that doc is able or unable to do for you. And that sounds awful, but that's the honest truth.
There's another question. They're asking naturopath. Does that mean like alternative medicine,
Correct.
like Eastern medicine?
Well, Eastern is different than alternative. Alternative is blending traditional and non-traditional. So many naturopaths are very skilled and trained in doing Western medicine. Some are not, so you have to do your homework and due diligence just like you do before you go to see any doctor. Is this somebody that I think I can mesh with? Or are you the person that just goes in and says, oh, it was a great experience. I think they're a good doctor. Well, do you really know? Have you checked that doctor out? Did you interview them ahead of time? Some docs will let you do that, some won't. Some systems just say, well, the only docs we have available are. Well, are they the only docs available because other patients can't get along with them? Are they being dropped? So you kind of need to do your due diligence. You don't just take a contractor that's available to do your yard work because, well, they're available. Well, maybe in a pinch, but what you want is somebody you can work with and talk to. And, so in other words, this is your health now. So you want somebody you can talk to, relate to, and is going to help you. You don't want just somebody who's available because it's covered by my insurance and they happen to have an appointment today. So yeah, I'll take you. Well, would you do that with your car? Would you do that with anything else? What about your pet? Would you just take the first vet appointment available and, the guy may be an absolute, doesn't know anything about the condition? Would you do that? So you have to put your priorities in line as to where do you put your health?
Right. I think I fall into the category of that's the doctor I've always gone to, and you feel like they have your best interest at heart, but you're really opening our eyes to really like do our research, do our due diligence, right? Because we don't know. They have a protocol, and I was unaware. Now I'm
Not
aware.
only do they have protocols, but they have quotas. They have quotas of, did you refer enough patients for MRI? Did you do enough mammograms? Did you refer enough to a surgeon? If you didn't, why not? And if you do it again, we're going to dock your pay. If you do it again, we're going to dock your vacation. You keep doing it, you're fired. And
Wow.
people don't have any clue that that's the reality that docs are in. Now, did docs set themselves up and let this happen to them? Yes. In the mid-90s, what happened is hospital systems, they're not dumb. They went to the docs and said, listen, we'll handle your back office for you. So all you have to do is worry about medicine and taking care of your patients. Well, what doc doesn't want to hear that? Great. I can get rid of my back office staff. The hospital can manage it. I'm already in the professional office building. I already do all my work here. So they have my back. Right. Great. They present them the contract. They signed it. And then 6 months later, when they realize, what do you mean I can't order a da-da-da-da? Well, it says right in the contract. Well, I didn't read it. Well, that's your fault, doc. You don't read the contract that you signed. We own you. We own you.
Wow. I'm
And if
just
you-
my mouth, I'm just floored. Like,
Right.
wow.
And if you try to back out of that contract, you have a non-compete and you have a geographic distribution that if you try to set up shop across the street, you're within our 25-mile diameter geographic setting. And by the way, that covers any of our subsidiaries? What if it's a national, hospital chain like, Aurora? Then you can't set up shop within 25 miles coast to coast of any Aurora Advocate hospital or clinic. Well, goodness gracious, that might just completely put somebody out of business, or they have to change to a different locale, maybe even out of state.
Wow.
So doctors did it to themselves, but they also continued to accept those conditions because that's now the norm. And so docs coming out of medical schools, are they going to look for the private clinic situation that I'm going to have to earn my way in, and it's going to be hard to pay off my medical school bills? Or are they going to be offered this fancy salary, come work for this hospital system, this university system, whatever, and you're going to get this salary and all these benefits? But what they don't tell you is we own you.
Do you see any change in the horizon and the way things are done?
No, because it's too fat and happy up at the top. In other words, all these administrators, they're just sitting back watching the show, and they really don't care if you get good health. They care about what is their bottom line that they present to their shareholders or whatever. That's what they care about. So it isn't about whether or not you're well, how many people we kept out of the hospital. That's bad for their bottom line. They want to keep people in the hospital doing more procedures, doing more things, inflate their bottom line so that now they're looking really good to their shareholders. So it's a business.
Well, I'm
It's
so
a
happy
business.
that you're opening our eyes and empowering us to take charge of our own health. I mean, I personally, I can say that that was not even a train of thought or a thought that ever crossed my mind. But now, after hearing you speak, it's something that's definitely I'm going to have to really like look at how I'm taking care of my health. I mean, luckily my health is great, but who knows? Like really like paying more attention how I'm feeling, like that checklist. I definitely want to look at that checklist. That's the first step.
Mhm.
Does anybody else here? I know we're running short on time, but does anybody else here have any questions for Dr. Mondloch?
Actually, I do. Dr. Moloch, thank you so much for um giving us an insider's view, because I've experienced it from the outside. I've actually have some friends who are in the inside, and seems like everybody knows the medical system here sucks, but everyone's playing along. It's pretty sad. I just don't know how sustainable this is as a
It's
country.
not.
The
It's
whole
not.
yeah, the
Mhm.
health of the whole country is at stake, but they're just continually, playing with the game. Anyway, I find it, and I was, to be honest with you, when you said you don't think this is going to change soon, I was I was hoping you're going to say something else. Um, anyway, I just want to clarify. So when you say you're suggesting for us to go to naturopath doctor, you don't mean homeopath, right? You mean doctor
Well,
of
i-
natural.
it's a doctor that can still prescribe for you if you need to take a bioidentical progesterone. You're not going to find a strong enough one online as a topical that's going to be able to do the job for you. In other words, you're likely going to need a prescription product, and somebody that can write a prescription for you. There are naturopaths that are trained and can do that. Their license will let them do that. There are some enlightened MDs or DOs that will do this level if they're independent. And so you have to look for an independent doc. But what I'm saying is look for somebody that can help by being able to write a script. If you
Got
get a
it.
surprise on blood work that says, oh my gosh, there is nothing natural that you can take. You can't eat enough yams, which is what progesterone
Yeah,
is
exactly.
coming from. You'd
Uh-huh.
have to have 3 truckloads of yams a day to
Right.
get to the level of progesterone you need. Well, that isn't going to happen.
So what is the title of the doctor? You said they actually can prescribe this sort of thing. I don't have luck finding an enlightened MD. What is the title I'm looking for?
Well,
DO
again, many
MD?
DOs, many MDs, if they're independent, again, look for the independent doctor, the doctor that has their own shingle out versus a university or a hospital based.
But
Um,
are they called the doctor of naturopaths or are they
No,
called?
they can be MDs just like I am. You know, I'm an OBGYN. So, but I was independent. I never worked underneath a hospital system, even though I delivered at hospital systems, you know, but I actually was so successful at doing everything I was doing, hormone balancing people. I went from the second busiest GYN surgeon at my hospital system for all of their OBGYNs to referring out 2 people a year for surgery, and it was due to cancer. So,
Oh.
you know, I've been there, done that.
Well,
And that's
I bet the hospital didn't like it.
well, no, and actually they tried to kick me out because I was decreasing the amount of surgery I was doing and I wasn't bringing in what they wanted. So
Mhm.
they looked for ways to work with my other partners to kick me off staff.
So well, I'm sorry to hear that. So do doctor of naturopaths, do they have the legal
Some
legal
do, some do not. It depends on
Oh,
their level of training. So you have to ask them that when you check into their credentials.
so
You
that
know,
credential itself doesn't mean they can. It's
that's
really
correct. That's
that's
correct.
interesting. Okay.
Right,
But
right.
Eastern doctors can, like a holistic doctor, like Chinese medicine, or they cannot do that, right?
They cannot usually. Now, a nurse practitioner can prescribe. So again, if a nurse practitioner is working independently, then make sure that she's doing blood work, or if she's doing salivary or urine, that's not going to be what you want as information. You want blood work information. So if you're going to interview a nurse practitioner who can prescribe, make sure that she's going to do that, you know, do it the way you want it done to help and benefit you the most.
Mhm. Thank you so much. Thank you for your
Mhm.
courage to to
Absolutely.
yeah, yeah. Every time I hear an insider talking about this, I'm like, I just can't believe it. It's
Mm,
just that's the state of affair here.
it is. We need to change it, and we need to walk with our feet in our pocketbook.
Mhm. Thank you.
Mhm.
Do we have any more questions? I know we're running up to the hour. Brenda, Melanie, Josh, Julie. Well, I appreciate you being on our call today. You have certainly opened our eyes, and I can speak personally for me. I'm definitely going to look at that checklist and just be more aware of how I'm feeling and taking more of a personal charge on my own well-being. And hormones was never really a thing that I looked at. I think for going to the gym and working out is like, I'm 46. I started doing like P6, which is a testosterone boost, like off and on, a few times a year, just to kind of, just build muscle and just feel more uh, energetic. Really, that's what it gave me. So now I'm going to look at that. Do you have any information on stuff like that? Like what supplements, or is that even a good thing to take, or how
Well,
does that work?
there are so many quote testosterone boosters out there. What you really don't know is you're trusting their marketing. Well, marketing is very savvy, and they're going to tell you that's what it does, but does it? You don't know until you see your hormone levels. So I won't even answer that until you know what your levels are, because I can give you the best marketing in the world and it's going to sound like $1,000,000 and you're going to do it and you're going to talk yourself into, did that really help? Oh, I think I had more energy, but do you really over time? So marketing is great. That's why everybody gets marketing degrees and hires marketing managers, but is it really doing for you what they say it is? They can say whatever they want,
Mhm.
but is it working for you? You need to know your levels. So I just encourage everyone, look into my books, know that you know someone that also needs this information. So help me spread this word that be an advocate for your own health. Take charge and know that you live in your body, and somebody else should not be charged with what is most precious to you, which is your health. Take charge of your health.
That's a beautiful message. Thank you so much.
My
We
pleasure.
appreciate you.
Mhm.
Well, thank you everyone for showing up on the call. I hope we all received what we were looking for. And if not, Victoria will be sending me some, I think those checklists you were saying, and maybe like a graph of what is normal for testosterone or hormone levels so that we can go ahead and get our blood drawn. That's the point that came through very clear versus saliva or anything else. Get our blood drawn and see where do we stand with our health. What's deficient?
Exactly.
Where's the imbalance? Where do we need to boost something up? And if we have any questions, are we able to reach out to you perhaps? Is there a way to get a hold of you after
There
the
is,
call?
and my website is, I'll have that in the email communication that I send back to you. And so people can check out, I've got radio shows, I've got YouTubes, I've got a lot of information on my website that people can check that out. My email is, I'm going to be gone for the month of March, so I won't be checking my email, and I don't want people to get frustrated that I'm not getting back to you. But it is, it's something I'll share with you, Noe, and that way, if people are looking for a specific question to be answered, then I'll let you go ahead and hand that out.
Okay, perfect. I know you're so insightful, and the question that we have in the chat is, do you do health coaching?
I do, and I will do it for patients in particular with any specific questions. So again, if they get in touch with you, Noe, then you can give them my email and we can go from there.
Okay, perfect. Sounds good.
Okay.
Thank you, everybody. Have a blessed day. Thank you again,
Thank
Victoria.
you.
Thank you
You're
so
more
much.
than welcome. Thanks for the opportunity.
Thank
Bye.
you.
Thank you so much. Very helpful.
Thank you.
you.
You're more than welcome.